Today, we're going to talk about where you can get reliable health insurance information online. With so much information online and healthcare and health insurance being so confusing, you probably don't even know where to start and what resources you can actually trust. In this video, I'm going to share with you a few of my favorite resources, tell you a little bit about each one, and then let you decide. So first, there's the Health Insurance Marketplace, or public insurance, or the Affordable Care Act plans. So there is healthcare.gov, which is the main site for the exchanges. Now, if you go to healthcare.gov, there's a couple of states that have their own state-based exchange, like California, New York. But typically, if you go to healthcare.gov, you'll get rerouted if you put in your zip code and you're in one of those states that has its own state-based exchange. And so the whole purpose behind these exchanges and these sites is so that you can compare plans and prices and networks and deductibles and all those fun things that you want to know when you're choosing a health plan. And you can even put things into a comparison chart so that you can see them side by side and try to filter down the information. And really the idea is that you could, if you wanted to, do that without an agent. Although I would always recommend working with an agent because you'll get even more help and it'll be a little bit more personalized to you. So one of my favorite tools to look up the marketplace plans, and here's the thing, I don't specialize in marketplace, I focus more on these underwritten PPO plans, but I help people with marketplace all the time because if somebody comes to me, I'm going to find the best solution for them, and sometimes it is marketplace, right? So with marketplace, I prefer healthsherpa.com. And so on healthsherpa.com, you can put in your zip code or the client's zip code, and you can put in your estimated household income. It'll actually estimate whether you qualify for a government subsidy or not. And what I like about that is that it'll show you all the different plans that are available in your area for you, depending on what it is that you put in that zip code, okay? And these vary by state. So like, let's say Florida, for example, where I have like so many clients, there's over 200 available options on the marketplace on that one site. And so you can really filter down, you'll see how they're ranked. They're ranked bronze, silver, gold, platinum. You can go to the higher end ones, and then you can put everything in a comparison chart. And also it'll estimate that subsidy amount. So let's say you're a little bit low income, you qualify for a government subsidy. It'll give you the estimated subsidy amount and it'll apply it to the monthly premium for all the different plans that it shows you. So you'll see the price that it will cost you, the estimated price that it would cost you, not just the full price of the plan. So it really tailors that to you so that you can have some knowledge before you make your choice. And the other thing is that you can enroll right through Health Sherpa. You click on the button, it'll take you to healthcare.gov and it'll let you enroll on your own. Or what I love best is when people use Health Sherpa as a tool before they come to me so that they're just more knowledgeable and empowered and they have great questions. And I can tell they've already gotten a little bit more aware of it, so they're not starting from complete scratch. They know a little bit, and at least they know what they want and they don't want based on what they've already learned on their own. Another tool that I love is that this isn't how to enroll in a health insurance plan, but it helps you with understanding prices and price transparency. So one of the things that can confuse people is not knowing what things actually cost, like procedures and surgeries and things like that. This site, Healthcare Blue Book, you put in your zip code and it'll give you a range of prices in your area, and it'll show you the range of prices that are deemed to be fair in your area. So if you're quoted a price for a surgery that is outside of that, then you should go and get another opinion, right? Because you'll know by that it gives you an idea whether you're looking at a fair quote or whether maybe that doctor just feels they can charge a little more and you'd be better off going to somebody different. Another tool that I love to use and I share with all my clients and even people who I just consult with is goodrx.com. So goodrx.com has an app and I have it on my phone saved. I used it this morning. It has all this fun stuff, but basically if you get prescribed a prescription drug, you can look it up on GoodRx. It'll tell you the cash prices at the different pharmacies in your zip code. and you'll see how much they vary. So this is something to give more price transparency about drugs, because not all pharmacies charge the same thing for the same drug. I know it doesn't make sense, but this is why this tool is there. It'll also tell you uses for the drug. It'll tell you if there's generics, brand names, generics of the same drug, or alternative options to that drug. Let's say the drug is a little bit too expensive and you want to ask your doctor to prescribe you something that does the same thing but is not so expensive. You can empower yourself and really arm yourself with that knowledge on goodrx.com. Some government programs that serve as resources for people in the US are Medicaid. So Medicaid is different depending on the state that you're in, but it is a federal program, but they're run differently at the state level. And so there's different Medicaid programs. Typically Medicaid is going to be based on needing financial aid. So Medicaid, financial aid, that's how I remember it. Because then when we talk about Medicare, that's for people older than 65. That's a big one. It took me a long time to figure out the difference between those, but that's how I remember it. And so Medicaid, you got to think of based on income, needing aid. And with Medicaid, there's different programs. So if you don't qualify for Marketplace, if your income is way too low, in some states you might qualify for their Medicaid program. If you are pregnant and you don't have insurance, or you're a student and don't have a job that offers you insurance and you're pregnant, you can get Medicaid for pregnant women. Most states have that at some level, although the actual details of those programs vary from state to state. A lot of times with the Medicaid for pregnant women, if a woman goes through her pregnancy with Medicaid, she'll be able to have her child get on Medicaid and be covered for the first year of their life, and they'll get a lot of extras, formula, all kinds of discounts on food and things like that. They really take care of them, and a lot of times the entire family will be able to be eligible for Medicaid for a short period, not forever. But the point is really these states want to support these moms and these pregnant moms and their babies. Another Medicaid program that I've seen and that I like is one that's called Medicaid Needy. So that's a program that is income based, but it's if you have unpaid medical bills. So if you've got unpaid medical bills, and let's say you were not covered by insurance or undercovered, like your coverage was less than it needed to be, and you have an outstanding bill, you can apply for Medicaid Needy. They'll determine what income that you have, and they'll determine what your cost share is of that bill. So they'll say, okay, based on your income, is there anything that we're willing to contribute as the government to help you out with this? And so that's all based on what your income is, and every state has different rules, or like a chart to go to determine that. But it doesn't hurt to apply, because when you're looking at that big unpaid bill, it doesn't feel good. So you want to utilize all the resources that you possibly can to help you bring it down. Now with Medicare is for people over 65. So what I say to people that come to me and want me to be their health insurance agent is, especially if they're like up in the 40s and 50s, it's like, okay, we're just trying to get you to 65, because at 65 in the United States, most people here will be able to qualify for Medicare. And Medicare is also a government program that is just specifically for 65 and older. But before you get there, you've got to have either Marketplace or some kind of a private insurance. Now for the kids, most states have what's called a CHIP program, and it stands for Children's Health Insurance Program. So all the states are different with this, but where I used to live in Florida, the CHIP program was actually pretty decent. What it did was you can have insurance through the CHIP program, and basically it's the state covering insurance for kids. And the idea is that a child should never go without insurance. So even if their parents don't have insurance or a family plan, the child will be able to enroll year long. So they don't have to wait for open enrollment. They can enroll in a plan year long and get coverage. And so some states require you to be low income to just be able to get any access to the program. And then other states, like I was mentioning, Florida has a full pay option and also a subsidized option. So if you're low income, you may qualify for the subsidized option, whereas like a plan that would normally cost $250, you might pay $20, you might pay $50, depending on what your income is. That would be the subsidized route. Now, in Florida, you can also get qualify for the CHIP program if you make too much money, and you just have to pay full price for the plan. And so that has changed over the years. The last time I checked, it was around $230, $240, a little bit extra if you want dental and vision and that sort of thing. But the point is, some states allow everybody to qualify for it, and you either just have to pay it, and some will all be based on income. So I went over a lot, and I know that that's a lot of resources, and so obviously there's a lot of help out there, but what people find confusing is they don't know where to start and what's the right resource for them. And if you, especially with government situations, government programs, if you try to call one of these places, it plans to be on the phone for hours and probably not get the clearest information. So the best thing you can do is consult with a licensed agent like myself. If you need support, if you have any questions about anything I said in this video, or you need help with your health insurance, I would be happy to help you and your family. You can find me at alexthehealthagent.com. Make sure to follow my Instagram because I have a lot of great videos like this one that can really help empower you. And if you liked this particular video, please share it and like, comment, and subscribe.